All right, we would like to call the meeting to order for the House Health Committee meeting for April 23rd. If you would, please call roll.
Representative Lee?
Here.
Representative Lipscomb?
Here.
Representative Hall?
Here.
Representative Sorrells?
Here.
Representative Mooney? Representative Warren? Representative Marcus?
Here.
Representative Gray?
Here.
Representative Rafferty? Representative Paramore?
Here.
Representative Rigsby?
Here.
Representative Holt Jones?
Here.
Representative DeBose?
Here.
Representative Shiree?
Here.
Representative Brinyard?
Here.
You've got a quorum.
Okay, first on the calendar today was a public hearing, and we will probably vote on its SB 87. Let's see your list there. We had 2 support, 4 opposed. What I'm going to do is do 3 opposed, 2 support, a couple of minutes apiece, and we'll let more speak that oppose it. And if you would, just kind of any way you want, whatever order you'd like.
And make sure you state your name and who you're with.
Yeah, that's right. Yep. Who you gonna call? You would just kind of, well, I'm sorry. I'm getting ahead of myself. Representative, you go ahead and speak on the bill.
I'm Senator Orr today. This is Senator Orr's bill. Yeah. This is Senator Orr's bill, and I had a companion bill, but he's got another meeting he wanted me to carry it for. If you remember from last year, we had a bill that we had a public hearing on that had that included language about freestanding birthing centers. Okay, some had a problem with that language, so we pulled that out of the bill, and there's also pending litigation on that and that was one of the reasons we decided to pull it. It also included language that allowed 3 screenings tests for newborns, which you'll hear about later. This bill, SB 87, started out with those 3 newborn screening tests included, but 2 of them were removed when the substitute was submitted over in the Senate. It passed the Senate, and so that's where the bill stands today. So the pertinent section is on page 9, lines 241 and 248. So now I guess we can hear from the experts.
Aaron Crawford.
If you would identify yourself and everyone, please, where you're from.
Certainly.
Thank you.
My name is Aaron Crawford.
Let me set the rules. I think all of you have already been in here enough to know. I'm on 2 minutes for each person that's speaking. Michael Ann she runs the clock, and whatever it is, in the middle of a sentence, whatever, we're going to cut it off. So let's try to keep it 2 minutes with the 5 we have speaking.
Understood. Hello, I'm Aaron Crawford. I'm president of the Alabama Birth Coalition. We fought for Alabama families' right to choose midwifery for years. Today, I'm calling out a disgrace. Senate leaders, pockets buzzing with lobbyist texts, gutted work by the Alabama Midwives Alliance. SB 87 has been hijacked. As is, it denigrates the sanctity of motherhood, the safety of newborns, and above all, is a wolf in sheep's clothing. March 15th, 2025, tornadoes hit Plantersville and Winterboro, Alabama. 3 died. We rallied, better sirens, faster response. In comparison, 58,000 babies are born in Alabama yearly. 290 kids of that 58,000, or 1 in 200, face silent killers, metabolic disorders, heart defects. No storm there, just cribs. But those innocent babies are just as threatened. And where will they obtain help in rural counties where care's a mirage, transportation? It's not a simple matter. Have some compassion. Midwives stand ready. They're not just delivering babies. They're lifelines, especially where doctors are scarce. Blood spots, pulse oximetry, hearing checks, simple tests a rookie nurse could do. They serve 64 counties, often driving to moms' homes. Midwives come to you. Only 24 counties have hospital obstetrics. 43 counties abandoned. Alabama midwives can't screen now, but states like Oregon, New Mexico, our neighbors Tennessee, prove they can. Trained midwives match hospital results No sweat. SB 87 is currently a gut punch. It bans midwives from providing the full battery of screenings our babies need, forcing moms to find far-off hospitals or take a chance. This is restricting access to care. 290 newborns at risk, and we're bickering. SB 87 slams the door on midwives, denying care to moms who choose home births. For what? Power? Money? Shame on those who would rather see a midwife fail than a newborn be saved. Equip midwives. Cut the red tape. You got a system that's proactive,
Time.
not
Linda Lee.
reactive.
Thank you. Thank you.
Chairman Lee, thank you. Thank you, members of the committee. I am Linda Lee. I represent 900 pediatricians across the state of Alabama. And today I'm representing Dr. Nola Jean Ernest. She is our legislative chair and a very dedicated pediatrician in Enterprise. She has sent me this statement to read to you. While it is legal in Alabama for families to choose home birth under the care of a certified lay midwife, there's no evidence that this practice improves infant mortality rates. In fact, in Alabama, the leading risk factor for infant mortality is poverty, a very complex issue that remains largely unaddressed. At a time when we are striving to reduce infant mortality, we must not compromise the quality of care provided to newborns. Lay midwives attending home births do not have the equivalent training or clinical experience as pediatricians or neonatologists. Even when compared to a nurse in a hospital setting, it is important to remember that hospital-based nurses have immediate access to a team of physicians and specialists when complications arise. As amended, this bill would permit certified midwives to collect the blood sample necessary for the state-mandated newborn screen. However, all further medical evaluation and care for the infant, including urinalysis, blood glucose testing, and clinical assessment and interpretation, should be performed by a pediatrician, family physician, or nurse practitioner within the context of a medical home. Dr. Ernest was very sorry that she could not be here today to deliver this message, but I can tell you that not only she voiced this, but she had a lot of other pediatricians who agreed exactly with her statement based on our email conversations yesterday. So thank you for letting me speak.
Thank you.
Representative Yarbrough? Sorry, Representative Yarbrough?
Thank you for the time this morning. I rise. I'm marked as opposed to the bill as it currently sits, but I'm for the bill as it was originally instituted. The issue arises, of course, with the amendments, and I'm well aware of the challenges that we as Alabamians face, both in striving for freedom for our education, the right to choose how we want to educate, the right how we choose the purity of our libraries and our birth freedoms. I have one child that was born in a hospital and 3 that were used with midwives. Obviously, hospital, we're grateful for both those birth experiences. And of course, midwives hearken all the way back to the days of Egypt and midwives there in Israel. And so, as amended, the rights, practices, options, and freedoms of Alabama citizens, I believe, are being abridged and taken away. Choices and options are being removed or denied from Alabama mothers because, it would seem, special interest and a general attitude that our mothers and their midwives can't possibly make good decisions and should trust the experts. I would humbly submit that 6,000 years plus of evidence would be different to that, and that it's not only un-American, it's a violation of Alabama State Constitution, Article 1, Section 35. The bill, in its original form, would do 3 things: ensure midwives can administer all newborn screenings, remove restrictions on trade and scope of practice, and maintain access to blood glucose screening. These changes will protect newborn safety and preserve access to evidence-based midwifery care. These amendments also close the loopholes that we're worried about by the ADPH's own screening language, so it protects babies and screening access without prohibiting safe, standard midwifery care. In closing, I would humbly urge you to take a good amendment that I understand is available for this bill to protect and preserve the rights and freedoms of Alabama's mothers. I urge you to consider the magnitude of this bill and even consider a roll call vote, because this bill is huge to our people and it will affect many, many precious Alabamians. Thank you.
Dane Howard?
Thank you and good morning. Dane Howard with the Alabama Hospital Association. I do not have a prepared statement or a lengthy testimony to give. As you know, we have been involved and engaged. And the only thing I really want to say, and I know it wasn't meant in the way that it was heard, but hospitals across the state have not abandoned labor and delivery. And it is obviously something that is near and dear to all of us. Being a new grandmother, it is to me as well. I just wanted to rise to say that the rules that have been promulgated that you all know in governing birth centers that are in litigation now, I can't speak to. And I won't speak to. There's an awful lot going on. But as it stands, the Alabama Hospital supported the bill as it was passed by the Senate and look forward to additional work in years to come to see what other avenues that we can make great strides in improving access to care, not only for women and newborns, but for all of Alabamians. Thank you.
Thank you.
Maria Crawford.
My name's actually Mariah Cranford. I'm here to speak to you in multiple different capacities. I'm a mother of 9, 4 of which were born at home, with licensed midwives in 3 different states. I'm a certified professional midwife with a master's in midwifery, licensed in 3 states, including here in Alabama. I have been licensed and practicing for over 10 years in other states. I currently practice in rural Northeast Alabama in some of those maternity care deserts and in Chattanooga, Tennessee. I'm also the former clinical director for the largest certified professional midwifery program in the nation, and I oversaw the clinical education of the type of midwives that you license here in Alabama. And I sat on that state's perinatal quality collaborative, working on a multidisciplinary committee to develop and implement policies promoting maternal and newborn health in that state. As a home birth mother, I experienced postpartum care from licensed certified professional midwives. That care included newborn exams, newborn screenings, help with lactation and newborn growth, referrals to pediatricians, and other hallmarks of integrated healthcare in the community setting. Per our national accreditation, certified professional midwives are trained and educated in the care of mothers and newborns through the first 6 weeks postpartum. I can provide you with copies of those curriculum standards for the newborn postpartum period if you would like them. This includes performing newborn exams, administering newborn screenings, critical congenital heart screenings with referral to pediatric cardiologists and Children's Hospital for abnormal results, and newborn screenings, including I've done the initial lab for congenital cytomegalovirus, which is indicated if you have an abnormal hearing screening, all of which I've taught students to do in clinical settings, not here in Alabama because I'm legally not allowed to. I've had them in my scope of practice for 10 years, and I currently do them as part of my scope of practice in Tennessee. I've received phone calls in the middle of the night from the state lab, checking on a newborn when an abnormal result comes back.
Time.
And had to send that to the hospital.
Thank you. All right, Representative, that concludes our public hearing. Are there any comments you'd like to?
Well, I would just like to say we've been another year, and there has been no infant deaths or mother's death. We've had a total over the 6 years of 200 transfers out of 1,902 births, and that's 11%. That's good, with no deaths of the mother or child. And I don't understand why we cannot get the screenings that would help protect the infants. So
Okay.
I would ask for that.
All right. Motion for a favorable report, second by Representative Francis Hope Jones. All those in favor by saying aye. Aye. Those against? The bill passes with a favorable report. Thank you.
Okay.
All right. You'll call the next bill, please.
House Bill 491 by Representative Ingram.
Thank you, Chairman. This bill is something that was brought to my attention by my grandkids and my son and my daughter-in-laws that, you know, when they come out to my restaurant, they said, we don't want anything with red dyes. And what I know about red dyes, you can put in a thimble and still have room enough for this building. So I'm no expert by no means, but doing the research that I've done since I've seen this in a phase of other people coming into my restaurant, and I've seen it now on the national level, being on the news recently, and other states have taken a proactive approach on to do something to curb this. A lot of states, I think there's 13 states that have passed this, that and several states have passed it to where there's no red dyes in any foods in their state. Most of them, I think there's more than 20 states that have passed or filed to where it takes it out of the schoolroom, out of the lunchroom. And the thing about the lunchroom is we all know that a lot of kids can't afford to buy lunch or bring their lunch because they don't have food at home. So when they get to the school, their parents do want them to eat healthy, and if it's got red dye that's a petroleum-based product and it causes behavioral problems and neurological problems, and that's proven that that's problematic to me. And, you know, I know this is a public hearing. The Alabama Board of Education supports this bill. The only thing, they have an amendment to where they would like for it to start at a later date because a lot of their foods have been on contract. But they're here now. Erica Hammonds is here, and they do support the bill. No problem at all other than the date. And I'll be glad to answer any questions. You've got a copy of the bill with you and what it bans. And this is not reinventing the wheel. This is being done, and like I say, it's filed in more than 20 states, and it's an agenda on the federal level with Kennedy.
In this bill, the start date, when would it be? A year or so to give preparation?
That's right. So in the amendment, it would be the 26-27 start date instead of starting in October, I think is when it is, yeah, or something like that. Yeah, the 26th.
All right, we do have a public hearing, and during your talk, you did speak about the amendment.
I did, yes.
Now, we don't have that in front of us. That's just come up, so.
I did pass it out.
Oh, you did pass it out? Okay.
And I know that people will probably speak, I don't know who signed up for or against, but the thing about it is it's for our kids, not about money. And in the school reimbursement, soft drinks is not part of the reimbursement. And so I'll leave it to a public hearing. Thank you, Chairman.
Thank you. Thank you. All right. If you would, we have one to speak in opposed and 3 minutes. So we're good. This one came up quickly, so thank you.
Virginia Bannister.
Good morning, Chairman Lee and members of the House Health Committee. I'm Virginia Bannister. I'm here on behalf of the Alabama Beverage Association. I represent the Buffalo Rock Company, Coca-Cola United, and all of the other Coke, Pepsi, Dr. Pepper Keurig bottlers here in the state of Alabama. As most of you know, we are in every corner of the state and in between, and we've been around for more than 100 years. Our bottlers make the products that Alabamians enjoy, including soft drinks, bottled waters, flavored waters, sparkling waters, 100% fruit drinks, sports drinks, including Gatorade and Powerade, dairy-based beverages, iced teas, and energy drinks. We're proud to be a part of the fabric of this great state. I'm here on behalf of my members to oppose HB 491. HB 491 would place the state of Alabama in an unprecedented position of regulating food and beverage ingredients. That's a role currently held by the U.S. Food and Drug Administration. The safety of our products is our highest priority. Americans should have complete confidence in their favorite beverages. A state-by-state patchwork of ingredient restrictions or bans will only create confusion for our customers and retailers. The integrity of our products is strong. All common beverage ingredients, colors, and sweeteners have been subjected to rigorous scientific review and have been approved for consumption by multiple regulatory agencies and authoritative bodies worldwide. Alabama's beverage companies are committed to providing consumers with the choices you want and the information you need to make the best decisions for yourselves and your families. We believe in guiding children towards healthy options And that's why we voluntarily removed full beverage calories from schools in 2006 through our school beverage guidelines. HB 4091 would create unnecessary regulatory burdens, cost, consumer and retailer confusion, and undermine the established role of the FDA. We respectfully request that the committee not move forward with this legislation. Thank you for your time.
Thank you. Thank you. We will, because of the amendment coming late, we will put this on the calendar next week, and we will have a vote on this next
Can I
week.
say one more thing?
Yes, sir.
Mr. Speaker. Europe has banned it years ago, and, you know, all we're asking is just in the lunches, what's in the schools. So, you know, they banned it in the 90s in makeup. Women can't even have it in their lipstick anymore back in the 90s. There's a lot of proof on this that causes problems, and that's all I've got to
And
say.
this is only in the school system.
Only in the school system.
All right, yes, please.
Mr. Chairman, will this apply to teachers as well? I mean, this would take
School lunches. It's just what's in the schools in their lunches. Is the meals provided by the schools.
Where does it say just lunches?
Well, it's K through 12. Well, it could be, you know, I don't know that they would have, the breakfast would be the same thing. Any meals provided in K through 12. You know, I don't guess you could have strawberry jelly if you had a biscuit the same way. If there's added dyes in it.
So let me just clarify. In Section 1A, it says, no public K-12 school located in the state may sell, permit the sale of, serve, or provide any food containing these things.
That's right.
So that would mean there could not even be a Coke machine on campus?
Well, I mean, I don't know.
Or teachers or anybody else?
I guess not.
Okay, thank you.
guess not.
I just wanted clarity.
Yeah.
Representative Hall.
Thank you. I just pulled up because I thought I'd heard someplace that the Food and Drug Administration had already
Banned
taken
these
it.
products.
Right. So it says on the FDA no longer allows for the use of the FDA and C Red number 3 in foods and ingested drugs. That took place
We're still doing
January 2025.
Yes, ma'am. And we're still, but just to you know, mirror that same thing that's on the federal level, just like we do on a lot of things, you know. Sorry, my phone's going.
I'm sorry, what were you saying? You saying we should be doing it anyway?
I said
that we need it?
we'll have to apply, I guess. You know, it had to be mirrored. You know, a lot of things that we pass here at the legislature that has to mirror the same thing on the federal level to adopt those same administration's rules.
But it also, well, consumers can see that information. So
I don't
just
see,
wanted
being
to
in the
bring-
food industry, I don't see anybody being proactive to take it out. You know, I'm not going to name any names. We don't use it in our homemade products, but there's a lot of industries out there, big people that are not preparing it to be taken out. And I think we need to just take care of our kids first. I think people need to write. A lot of states have banned it through coming into their state on any foods. And I think people ought to have the right to be able to eat what they want when they get 21 or out of school. But when they're in school, you know, we're given free lunches a lot of times, and these parents don't know what their kids are eating. My kids, you know, want to make sure that my grandkids are eating right, you know, at schools. So does that answer your question, Ms. Clark, or not? Not at all.
No, you didn't help me at all, but that's okay.
All right.
I'm good.
Yes,
Representative Rafferty.
Thank you, Mr. Chair. So, Representative Ingram, I'm just curious, so a lot of times kids will have a Valentine's Day or a Halloween party or something along those lines. Would this restrict the kind of
I think
candy or
if they
treats
brought
they'd
it
be
with
able to
them,
bring in?
you know, if they brought it in, that would be something permissible by the parents. But I don't think we ought to keep giving our kids poisoned. I mean, you know, behavioral problems, suicide is up, neurological problems, ADD, ADHD, and it's proven. It's the facts that's been proven, you know, by the FDA.
What's been proven?
About neurological problems.
That we're seeing a wider prevalence of these.
That's right, because of these red dyes.
Do we necessarily have
petroleum-based.
causation established in any of that research?
Sir?
Do we have causation, or is this a spurious relationship that you're talking about?
No, I think I can get you the proof by the time we go into session. I can lay it on your desk.
But my question still is, with these kids that would be, I don't know.
If it's something that brought in and that kid is, you know,
give out
consuming
to
on
other
their own,
kids.
I think that's something that the parents sent. but what the schools are providing, no. I don't think it ought to be, checked at, and this bill would not have them checked at the door to see if they got it like a gun. But, if you bring it in your own lunchbox, that's fine, but if you.
But
if you
I'm
let
talking
the
about for
school-
Halloween or for Valentine's Day, and they're giving out this stuff to their classmates.
I think that would be,
Would there
there's a
be-
lot
would
of
there be-
alternative stuff.
Would there be a restriction on that?
I don't see that in this bill.
Okay.
I don't see
Thank
that
you.
in this bill.
Any other? Yes, sir. Representative Mooney?
I just have a question. I remember where Representative Ingram, you said that the State Department of Education had someone here.
They do, yeah.
Who
Erica
supports
Hammond.
the bill. Is that the State Department or the state?
Education.
It's the State Department of Education, not the State Board. My question then would be, why is it necessary for us to do this? If you want to do it, why are you not doing it through the State Board of Education?
Thank you.
And I agree that we all need to protect our
If you,
children.
Representative, if you ask a question, I need everyone to be able to hear the answer. Okay.
All right.
Yes.
We were just responding to the representative asking us to come take a look at this bill, which is currently being considered. I haven't seen anything like this being considered before the board at this time. Not that it might not be coming, but what we were able to do was to talk to our folks that do the child nutrition program about the feasibility of being able to comply with the law. And since we do our budgets so early and our contracts so early and do so much purchasing, our contracts for next year are set. We will be RFPing this fall, so it would be impossible for us to comply with the bill as written. So we did request to put an amendment on it for us to comply in the next school year instead of 25, 26.
All right.
May
Any
I
other
follow up,
members have?
sir, with one other question?
Yes, sir.
Then do I understand that it is the desire of the State Department of Education to try to deal with this subject on their own through the state board?
At this time, and although I represent the department and I'm also a part of council for the board, we are dealing with responsiveness to the bill that has been put forward. And that
I realize
is
that.
really the only position that we have at the moment, is trying to make sure that if this becomes law by August, that we could comply with state law. Now it, of course, is an issue at
Totally.
the department, but I have not heard any of the board members discuss this at a work session or in any of my interactions with them. It doesn't mean it's not an issue that they might not bring up.
Well, totally understand where you're coming from and understand about budgets. And I am committed to the concept of protecting 12 grandchildren that I have, just
Yes,
as
sir.
I think Representative Ingram is trying to do that. I also understand the position that's being taken by the Soft Drink Bottlers Association. I would ask you respectfully to present this to the appropriate people at the State Department of Education. I don't know what will happen here today, but this obviously is a concern that needs to be looked at and dealt with, and it just seems like we spend time in areas that we're not experts in, and I would hope that it could be done in a manner that's more productive to the final result.
I appreciate that, and there's one
Okay.
particular board member from here that I'll definitely be able to
Okay,
talk to.
Representative Shiree. Thank you. Thank you. You can be seated.
Yes, sir.
So I was looking at some of these dyes online here, and the FDA has just banned some of these dyes, correct?
Yes, sir.
And they have until January 15th of 2027.
27. But it'd be
And
great to get ahead of
drug
that.
manufacturers until January 18th of 2028.
Yes, sir.
I would respectfully recommend that we follow those federal, if we're going to ban these,
Right.
I would recommend that we follow the same
And I
dates
get that,
as the
but you know what?
federal.
Our suicide being so high, and we being number 3 worst states in the union on longevity. I mean, we're only life expectancy is 71.6, something me and the chairman been working on, and then suicide has been so high, and it's we have a lot of medical issues. Why not take a proactive approach to save a life? If it can save 10 lives or 1 life, why not go ahead and implement it pretty quick? Behavioral problems, ADD, we're prescribing so much medication now because, it's got to be something that we're eating and something we're doing, so it's already been proven that it is a problem. So why not we take a proactive approach and not sit back on the sidelines? But I hear what you're saying.
I haven't seen those studies, but
I'll lay them on your desk
because
when we come back in.
because the federal guidelines are giving these manufacturers, they're putting them on a timeline like this. Everybody's going to be doing this.
So over 20 states have taken a proactive approach like us, and there, a lot of them
understand,
are red ones,
but
red and blue.
That's a lot to change the formula of Coke over.
I'm just talking about in the classroom. I'm not talking about taking, I don't know that, I drink Cokes and I drink their products, and I appreciate what they bring to the state. But I don't know that our kids need to be drinking it in school while we're trying to get them to learn. But anyway.
Mr. Chair, I call for the question.
Yeah, well, I will. This will be the last. Representative Branyard.
Can you give me some examples of the types of foods and
So,
beverages that this
and
would involve?
some of the stuff is like even strawberry ice cream or strawberry jelly, your soft drinks, you know, a lot of everything we eat. I think it would be probably 90% of what you consume would have some type of the dyes in them, and it's a petroleum base. It's gotten a lot worse. It's been banned in Europe, and like I say, they banned it out of makeup, and we've just gotten back as a society because food has been so, you know, we want to make it taste better and look better, and it's all about that. And Europe has gotten away from it. There's other ways you can do the dyes without, but it's a little more cost prohibitive.
All right, that ends the public hearing.
Thank you,
and
Chairman. Thank you,
looks
committee. I
like-
appreciate the questions, and I will get that information to y'all.
Okay.
Thank you.
Very good. Thank you.
Senate Bill 43 by Senator Melson.
Thank you, Senator, Chairman.
Mr. Chairman. I'm here to represent the Red Velvet Cake Association. And
Sorry. Is there enough pieces for all of us?
I just need a majority. All kidding aside, this bill that I'm bringing forward today has to do with remembering that cost is obviously a concern in healthcare, but it shouldn't be the driving concern. And we need to make sure that healthcare providers.
Yeah, a little closer where everybody can hear you. There you go.
It just means this bill just wants to make sure that healthcare providers are not gagged in any way and can talk freely about the costs and alternatives with healthcare choices. And you don't think about this, but I know Representative Rigsby knows about it. It kind of has to do with PBMs and things like that. But if a physician wants to talk to a patient about alternatives, whether it's antibiotics, whether it's total joint, different varieties, what he thinks best for them, and not necessarily the bottom line for the hospital or nothing person hospital association, but we just want to make sure that they do what's best. You know, quality, accessibility are main drivers in healthcare with providers, and we want to make sure there's no way. And you know that now that private equity is getting involved with employing individuals as well as hospitals and other organizations, and we just want to make sure there's no prohibit on them in their contracts to be able to talk freely about the other options. And I think we have an amendment that I'd like, if you don't mind.
Representative Shirey.
Mr. Speaker, I have an amendment. This amendment would replace line 13 on page 1 with the following. This is really just cleanup. It says, and availability of treatment of drugs and to prohibit. We're adding the and, the A-N-D. The next is we're going to replace lines 16 through 17 on page 1 with the following. Information to patients or other individuals, period. A period, not a semicolon. The last part is the substantial part is we're going to replace lines 106 through 115 on page 4 through 5 with the following. Section 2, this act shall become effective on October.
Mr. Chairman.
Basically, we're going to take out the cause of action.
That's correct. And in some ways I have concerns, and I think you may have to look at it at a further date. But for now, I think that's a reasonable compromise where they can't. You know, it's kind of like having a Rottweiler and pulling his teeth. This takes a little bit of the bite out, and I think that's acceptable and reasonable. We'll look at it further. Thank you for offering that.
I would like to say this is a good example of working and trying to figure out where in the middle of the road that we can get that doesn't hurt one group or another. So you did a lot of work on it, so thank you.
Thank you.
And a lot of other groups in here. All right, who did the first motion? Shirey, did you do a motion? Oh, yours is with the motion. Got a second? Those in favor of the amendment by saying aye. Aye. All right. We have the bill on amendment. You got a question? A motion. Motion by Representative Marcus, second by Representative Rafferty. All those in favor of all those in favor as amended by saying aye. Aye. Those against, nay. Bill passes. Favorable report. Thank you,
Mr. Chairman.
Thank you. All right, we have one more.
Senate Bill 101 by Senator Stutts.
Representative Bose.
Thank you, Chairman Lee. Thank you, committee. I'm here today presenting this for Senator Stutts. I've actually been working with him from the beginning, along with Senator Gavan, on this bill, and we have worked with the Medical Association and mental health and individual doctors, and I think we've come to a really good compromise here with this bill. And I do have a sub to present. Would you like me to talk about the bill first and then the sub? Or
Just
do it all
go
together?
straight to the heart.
Yeah, I'll just go ahead to it all. So as y'all know, or you may not know, but since 1972, the age of consent for all medical care in Alabama, from mental health to general health to dental health, has been 14 years of age, and this bill seeks to raise it to 16. 14 years of age is actually the lowest in the nation, and only 3 states have an age of consent for general health care decisions below 18. In fact, today, if a 14-year-old child does not give his consent, parents do not have access to his medical records, including test results or diagnoses. This bill is a compromise after working with MASA and mental health organizations. And I understand the concerns of all these medical professionals. And while I may not have wanted 16 to begin with, I wanted 18, we all did, this is far better than 14. And I think sometimes that's what we end up doing on legislation, is working with everybody and coming to the best compromise that we can all live with. The good thing about this bill is it does provide parents with access to all medical records of their minor child, and so I'm very happy with that. There are a few exceptions that have been in the bill from the beginning that I just want to point out to you. Divorced or pregnant, you make all your own medical decisions. If you're emancipated, you make all your own medical decisions. Furthermore, a minor may give consent to determine the presence and treatment of STDs, pregnancy, and alcohol. Professionals may provide emergency service without parental consent in the following circumstances: if there's an imminent threat, if there's suspected abuse, neglect, or exploitation, and if there's an immediate need for grief counseling. Authority over their minor's decision up to age 16. I hope that you'll be able to vote in favor of this bill.
Thank you. A lot of work's been done on this. A lot of people have been at the table to come to this final version. So we have any questions and second to adopt the substitute? Those in favor by saying aye.
Aye.
Those against, nay. All right, now we're on substitute. Any questions about the bill as substituted? All right, motion and a second by Representative Marcus and second by Shiree. All those in favor of the bill as substituted by saying aye.
Aye.
All those against, nay. Bill passes with a favorable report. Thank you.
Thank you, Chairman. Thank you, committee.
Okay. All right, that concludes. Okay, that concludes our meeting today. So thank everyone for coming. Thank you, committee members.
So sorry, go this way.
All right.